Hi, my name is Madeline O'Brien, and today I'm going to be talking about memantine, or it's also known as the brand name Namenda. And we're going to be talking about how it affects cognition and behavior in Alzheimer's disease. And more specifically, I'll be focusing on its biological mechanism as an NMDA receptor antagonist and how that mechanism helps explain the clinical effects that we see in patients. To start with some background, memantine is a synthetic medication that's prescribed for moderate to severe Alzheimer's disease. It's classified as an NMDA receptor antagonist, which means it acts on a specific type of glutamate receptor in the brain. This is important because glutamate is the main excitatory neurotransmitter in the central nervous system, so changes in glutamate signaling can have major effects on brain functioning. Memantine, it was approved by the FDA in 2003, so it's 22 years old or about to be 23, and it's mainly used in patients who are already experiencing more significant cognitive decline. Alzheimer's disease is a progressive neurodegenerative disorder that causes gradual damage or loss of neurons that causes memory loss, impaired reasoning, and difficult in everyday life and function. For drug effect, the first major category of effects I focus on is cognition, because that really is the central issue in Alzheimer's disease. Memantine does not cure Alzheimer's disease, and it does not restore neurons that have already been lost. Instead, its main role is to slow the progression of neurocognitive decline. In terms of specific cognitive effects, memantine has been associated with improvements in areas like working memory, attention, and aspects of executive functioning. So, working memory is important because it helps people briefly hold and use information, such as following a conversation or remembering what they were about to do. Attention is also important because Alzheimer's patients often struggle to stay focused or process information efficiently. Extreme functioning and executive functioning involves higher level mental processes, so planning, organizing, and making decisions, so of course that's impaired. The drug itself is not curative, but modest preservation of cognitive function can matter a lot in progressive diseases like Alzheimer's. In addition to memory and thinking problems, Alzheimer's disease also affects behavior and mood. So this is why I separated this slide from the cognitive effects slide. I wanted to show that the drug's impact is not only about mental performance, but it's also about emotional and behavioral stability. Behaviorally, memantine may reduce symptoms like agitation or aggression. Alzheimer's patients may become confused, frustrated, overwhelmed, but that can come out as disrupted or distress-related behaviors. Affectively, memantine may also help with aspects of mood regulation. So, in other words, it may reduce emotional distress that develops as cognition gets worse. It may also help stabilize some emotional or behavioral consequences of ongoing neurocognitive decline. These behavioral changes also have a functional impact, so if a patient is more cooperative, calmer, and better able to engage in daily activities, that can reduce caregiver burden and improve quality of life overall. The next session is pharmacokinetics, which we talk lots about in class, and I love pharmacokinetics a lot. In memantine, it refers to what the body does to the drug, and this includes how the drug is absorbed, distributed, metabolized, and then eliminated. So memantine is administered orally, such as like a tablet or a solution, which makes it practical for long-term and daily treatment. One important pharmacokinetic feature is that it has a high oral bioavailability, so it's close to 100% oral bioavailability. It also absorbs efficiently from the gastrointestinal tract, and after absorption, memantine crosses the blood-brain barrier, so it's essential because it targets receptors that are in the central nervous system. So once it reaches the brain, it can directly influence your neural signaling. In terms of metabolism and elimination, memantine undergoes minimal liver metabolism, so much of the drug remains unchanged in your circulation. It also has a relatively long elimination half-life. It's around 60 to 80 hours. Memantine is excreted primarily unchanged in the urine, so what we were just speaking about a second ago, and the renal function plays a really important role in how efficiently the drug is cleared. There's also no evidence, or it's very limited, of the significant enzyme induction or inhibition. There's no strong evidence that depot binding meaningfully affects its bioavailability. Pharmacodynamics explain how the drug works in the brain. Memantine acts on the glutamate system by blocking NMDA receptors as an antagonist. So, in Alzheimer's disease, there's too much glutamate activity, which overstimulates these receptors and leads to excitotoxicity, or the neuron is damaged caused by excessive stimulation. Memantine reduces this overactivation, which helps prevent any further neuronal damage. This is really important because by protecting the neurons, it helps slow that cognitive decline and stabilize the behavior. So the drug's mechanism directly explains the cognitive and behavioral effects that we discussed earlier. So for dependency and abuse, memantine has a very low risk of physical dependence and abuse. There's not a lot of evidence that point anything towards like a tolerance or a withdrawal, and it doesn't produce euphoria or any sort of reinforcing effects. This is because it's simply not strong enough to activate any sort of dopamine reward pathways. Instead, its effects are stabilizing and neuroprotective, so it makes it stronger for long-term use compared to a lot of other drugs that act on the brain. And then as we come to a close here, memantine, just to remind you, it is an NMDA receptor antagonist, and that works by reducing excessive glutamate activity and prevents excitotoxicity. This helps protect neurons, slow cognitive decline, and it helps stabilize behavioral symptoms in Alzheimer's disease. Overall, memantine slows cognitive decline by blocking those NMDA receptors and reducing glutamate-induced neuronal damage. And that is going to be my presentation on memantine. I hope you learned a little bit more about Alzheimer's and memantine as a drug itself. So thank you for being with me for my presentation, and I hope you guys all have a great day.